Dr. Usha,
Hi.
how are you?
Good. Very good. Thank you.
Well, welcome to the show.
Thank you very much for calling me. Actually, it's an honor to be here.
Oh, it's an honor to have you. Dr. Usha is a gynecologist in Prime Hospital
Yeah.
and deals with women's health
Yes.
and also featured in the newspaper for, I think, 168 fibroids, removal of 168.
Yeah.
It's really nice.
Yeah,
Really nice.
It is. Yeah.
I'm very proud that...
And preserving the uterus after removal of the 168. That's, I think, the most important thing.
Yes, very much. And I'm very, very happy to know you because you welcome my daughter into the world.
Thank you. That was nice.
So, doctor, tell me more about this massive feat that you've removed 168 fibroids. For those who don't know, especially me,
Okay.
can you tell me more about this?
So, fibroids are basically what we call non-cancerous tumors of the uterus. And they're very common tumors, actually.
Okay.
And if you scan about 100 women, you'll find about 50 will have fibroids, okay, of some size or the other.
Okay.
When they're very small and, minimum in number, they don't really cause any major issues, and we don't say surgery is required. Okay. Now, when they get bigger, they can cause various problems like bleeding, pressure, and depending upon the sizes, what they're pressing on. So if they're very big in size or very big in number, they will require removal at some point. Okay. Now, when we have fibroids and we're looking at surgery, we're looking at somebody who's old, like 40 plus, who's already finished childbearing. In those cases, we just remove the uterus because that's much more easier and kind of a final treatment for it, because we don't want to leave the uterus and then get more fibroids, because you can make more fibroids.
Okay.
But somebody who's younger, who has got many fibroids, then we can't afford to take the uterus off because they need to get pregnant, childbearing. So in those cases, we remove only the fibroids.
Right.
Majority of the fibroids can be removed laparoscopically. But if you have somebody who's got, like the large number that I had, 168 was a large number.
Right.
In those cases, a complete clearance on laparoscopy is, I wouldn't say impossible, very time consuming and more difficult.
Okay.
So in those cases, we opt for open surgery. Okay. So far, since you mentioned the number, 236 is the Guinness World Record.
Wow.
So we are kind of less than that, but it's a large number. And previously, before this, I had removed, my maximum number record was about 68 or something.
Wow.
So this was
double.
like jumped from there to this thing. Otherwise, on a general scale, I do about, say about 30 to 40 surgeries a month. Out of them, probably 20 or fibroids.
Right.
And I, on a regular basis, every day I remove at least about 5 to 6 fibroids, sometimes 8 to 10, 15. So those are sort of the regular numbers.
Right.
168 is once in a lifetime, I suppose.
And like you mentioned, the uterus was
Conserved.
conserved.
I think that's the having that many fibroids and removing, that is not the issue. When we remove that many fibroids, there is a possibility of quite a lot of bleeding, and then sometimes you might end up losing the uterus. But in this case, it was, we managed to do it. We didn't even give a blood transfusion. So there are techniques that we use to reduce the amount of blood flow and everything else, and then do it, and it worked out very well. Patient is very happy.
Well, congratulations, doctor. And we are happy for the patient as well.
Thank you.
Does this hinder childbearing? Fibroids?
Not always.
Okay.
So if somebody came to me and said they had a few fibroids here and there, and they say, can you remove the fibroids because I want to get pregnant? The first thing I tell them, try to get pregnant on your own, because these fibroids might not actually be interfering with your fertility at all.
Right.
Okay. So they're like innocent culprits in the game. So if they can't get pregnant, then I would say we'll investigate for other issues which could have been, the problem. If, for example, they've done everything, we can't find anything else at all, and especially if the fibroids are coming into the cavity of the uterus,
Right.
those are the ones which probably will help fertility if we remove them. The ones which are not coming into the cavity, no point, really. They're removed for other reasons, not for fertility reasons. They're removed because they're causing pressure, they're causing too much of bleeding, they're causing pain. Those are the other reasons.